Thank you for joining us on this segment. Now, it's one thing to consider, giving back to the society, helping people who may or may not be able to help themselves. But it's another thing to actually walk the talk. Now, my guests this morning, are Dr. Sylvanus Achu, who's a medical doctor, and his wife, Mrs. Oluwafumike Achu, who is a nurse and an entrepreneur. They just recently opened a dialysis center in Isolo, Lagos. That's Strong Tower Health Services. They've been abroad for a number of years, and then they came back as their own way of giving back to the society. What's this all about? You'll be learning just shortly. Good morning. Thank you for joining us.
Good morning.
Now, doctor, tell me what the Strong Tower Health Services is all about.
Yeah, so I finished from UCH in 1990.
Okay.
And served in an African country, served here for some time, and then went to the US for specialization. And when I finished school, I always wanted to specialize, but after staying abroad for a while, it was my desire to give back to my alma mater, to the people where I came from. So my wife and I had always discussed the need to provide something unique to meet a need that's not commonly met in the society. And it was while we were thinking that we got wind of the epidemic of kidney failure in Nigeria. So we started thinking of whether we needed to step in to help or not. And my wife has been here for some time now to just look around dialysis centers. And they were just okay, but they did not meet the standards that are in other parts of the world, like in the US. So it became our desire to do something to make a difference, to touch the lives of those patients. To do it properly like it is done in other advanced countries in the world, to bring the latest technology. You see, it's one thing to get dialysis and it's another thing to get properly dialyzed. You can sit in a machine and get connected and you see, your blood running around and you have the feeling that something is being done. But it's another thing to get proper clearance, to have the wastes really taken out of your body the way they are supposed to. And so we got the latest machines, to do just that. So we can bring to our people as a way of being a blessing to the country that has blessed us so much.
Now, when he shared this vision with you, when it was first conceived, how did you see it?
Initially, I embraced the idea because that's what I do.
Okay.
I've been in the industry of dialysis industry in the US for the past 18 years.
Okay.
And the last 12 years I've been building clinics. So when I first looked at it, I thought it was a good idea, but the cost, because even in the US it costs millions to build one. And we were talking about if we had to do it, it had to be the real thing, not a mediocre.
Not a regular thing.
Yeah, not a regular thing. And one of the things was, for me, I felt like integrity is also involved in it.
Okay.
That I had to come here and see how the dialysis clinic is being done and what they use and compare to what is done in the US. So I came here and I moved around states and look, and when we came back with the other partners, we met and we started talking about the cost. It was very expensive, but it was this driving us that why should people come abroad when we can bring abroad to Africa? And that's how we started. The whole plan started.
So, away from conception now, getting the right people to, I'm not sure you could have done everything by yourself.
No.
Getting the right people, getting people to align with that vision, how easy was it along the way?
Thank you for asking that question. It's a pertinent question because we have tried to do something in Nigeria before, but we tried to do it with the wrong persons and we lost a whole lot of money. a whole lot, but we are not getting into that now. I believe that the Lord ordered our steps to talk to the right persons. Our partner is an engineer who specialized in hydrology, coincidentally. Hydrology being the science that deals with water, connections of water and so forth. And water is something that is really needed in dialysis because there's a lot of water used to dialyze one patient. So we needed him because we had to set up the system exactly like it is set up in the US.
Okay.
And so far there's nobody in the country who can do that. I think we have actually set a precedent that many centers will come to study from. So this person we got to meet in church about 20 some years ago. We attended the same fellowship and we just developed, respect for one another. Trust is very important when there's hundreds of thousands of dollars involved. You need to trust people. So we discussed, we set a plan, set a budget, and he came home here and started the work, got a team of other engineers and specialists, electricians and so forth, and they put it up. And the next challenge was getting competent dialysis nurses and technicians to repair the machines, because that's another issue. Machines break down and a lot of centers don't know what to do with it, and they close shop. We don't plan to close shop ever. We have come to serve, and we will serve no matter what it takes. So we are ready with all of that to make sure that if anything happens, we are prepared to fix it.
Now, it's one thing to want to do all of this. It's another thing, in fact, to set the plan in motion. But all of this, all the efforts that have gone into this, all the money that has gone into this, it goes without saying that the whole idea is very cost intensive.
Right.
So the business side of it, how do you intend to recoup all of the money that has gone into it?
Yeah, good question. Thanks for asking. We're not in a hurry to recoup any money. We want this to be sustainable first. We want to see patients come, they get blessed and served and taken care of, and our workers well paid. And then, of course, I would be glad if we can recoup some costs as time goes on, but we are not in a rush to recoup costs.
Okay.
We are not in a rush to recoup costs. We are more concerned with seeing people blessed. We want to get testimonies that people come and get encouraged, get blessed, get felt better because they had that real good treatment compared to ones that they've been getting from other places. So, go on.
If I may say a bit, actually what we are doing, the outside worlds are actually waiting to see. Like some of the dialysis company in the US, they are looking forward to something like this in Nigeria. So us coming, we are like kind of an experiment.
Okay.
For some of the companies that are really interested, and they've been looking at how feasible it is to do it and sustain it in the US. So yes, we look at sustaining it, but most business, you don't start and expect to recoup immediately, especially when it comes to dealing with life. Your goal is not about getting your money right outrightly.
So are you getting organizations to fund this?
One of the things is we're looking forward to is getting organizations to be involved in it.
Okay. Like what sort of organizations?
Maybe non-profit organizations, the government.
Okay.
Yeah.
We plan to seek access to governors. We actually invited the governor, during our launching. I think he was busy. But we have to actually sit with health officials and discuss the issue. We have to begin to hold our officials responsible and accountable. If a significant percentage of the population are afflicted with a certain disease, we just cannot afford to continue living our lives as if, everything is fine. There are people with a death sentence pretty much hanging over their heads. So we can't just say, As long as it's not me, all is fine. You know, so we have to hold them accountable. Say, please, sir, we need to take care of these people. Is there anything the government can do to subsidize, to make it affordable to them? We are not saying you pay 100%. Of course, we'll be glad if you do that. But at least, is there some subsidy we can get so we can reach out more people? Or so we can take care of that one out of maybe 5 who cannot afford the fee.
The fee.
That's right, exactly. And then also, like she said, non-governmental organizations, which we are still in the business of compiling and this stuff. Yeah, that's right, exactly.
And one of the things we also offer, which has not really been done, is doing dialysis in critical care in ICUs.
Okay.
We have the mobile machines, I'm sure, where patient they don't have to move the patient. They can be there and be dialyzed.
Okay.
And we also provide home services. So if people don't want to come to the center, they can be dialyzed at home.
Oh, okay. So, I mean, these all sound really great, but is there a reason why you chose to locate the establishments in Lagos? What about Oyo State? What about Ogun State? Why Lagos? And are there plans, say in the long term or short term, who knows, to have other centers in other states?
Yes, there are plans to have other centers in other states. And the next state will most likely be Oyo State in Ibadan.
But why Lagos
Why
as the
Lagos?
first port of
We
call?
started with Lagos because the proximity, you know, and then the population is in Lagos. Lagos is like, you know, much large. I mean, so many people in Lagos. And wherever you have a huge population like that, there's a chance that the percentage of people who actually have that affliction will be higher than just a town like Abeokuta or even Ibadan. So because of that population that's there, we thought it would be good to reach out to them. Ibadan is also in need of that because my wife went around and you know, she stopped at some centers and they had very few machines, some of which were not working, some of which were
Maybe
down.
she should tell us
So-
that experience.
I think initially we wanted Lagos, and then at some point I came to Ibadan and I saw the great need because I went to my alma mater and realized that out of all the machines, UCH, only 2 machines was working because they didn't have some of the things that they need to use. And I saw the environment. I don't want to talk much about that. And I also visited some other clinics and I was appalled with the treatment. And I actually said, oh, Ibadan really needs this so bad. But I looked around for real estate. It was very difficult to get real estate. And actually spent like 3 days looking around to get a place. It was very difficult and we were able to get something instantly in Lagos.
Lagos, yeah.
So we said, let's start with Lagos. And the next one, we really in our heart want to do the one for Ibadan because I feel there's a need for one.
In
In
Ibadan as well.
Ibadan.
Well, let's thank God that it's already set up in Lagos.
Right.
One of the things that comes to my mind now is the fact that many specialists in the health sector are traveling abroad, especially the best brains at that. Now, would this be a challenge to the center?
You will be the best at that.
Many specialists are traveling abroad. Will it be a challenge to the center? Not really. Not really, because well, you're right about that. So far,
would you be? I want to believe there will be a number of doctors, a number of health specialists who would be, handling different things at such a center.
that is right.
Would you
exactly.
also be one of them? Are there other people? Would you be flying in some doctors? How does that go?
That's a good question. Since I will not be here for a long time, I would not be one of them. However, we'll have a medical officer, we'll have a nephrologist, and that is where your concern comes. The fact that so many specialists are moving
traveling
abroad. Just to let you know, in this country we have less than 100 nephrologists. As large as this country is, the exact number is about 70.
The entire country.
Yeah, in the entire country. So that makes your question now very relevant, because if the 70 now flee, then we'll be left and you need a nephrologist to open a dialysis center.
So what are your plans in that line?
So far, thank God, we have enough nephrologists to, work with us to open centers.
Okay.
But if it means, I don't think we'll ever get to the level where they all travel abroad and nobody's left here, hopefully.
Hopefully.
And so far, I think the nephrologists that have come to see the center, they were quite amazed. Okay. Even our medical director, she was shocked. She just came back from the US, on a visit. Okay. And the first day she came and she saw it, she was like, oh my God, this is different from what I've ever seen. And we're like, yeah, that's what we wanted to do. We wanted to wow everybody. And the goal is not just to show off that you can build a center. The equipment, actually, most of our equipment, even the water room, which is not common here, we did it the same way they do in America, the whole RO system, how the water is treated. And we have support. Okay. They are willing to travel here if there's anything that they need to do. Okay. They are willing to do a Skype to assist us with, and we have Fresenius, which we use their company. Okay. They have a representative in Lagos, which you can always call if we need anything. So we're kind of, it was well planned from the beginning that if we need anything,
you can always get help.
No,
it's one thing to have this on ground. It's another thing for people to know about it, to know that if you need something, you can always get here. In terms of awareness, what has been done in getting the people aware that there's a place they can go to if they need such services.
Yeah, it would be good to take this opportunity to tell the public that there is a brand new dialysis center in Lagos, number 33 Okota Street.
Okota Road.
Okota Road. It's all on Lagos. She's laughing.
Okay.
It's all on Lagos.
Okay.
You show up there and you'll receive excellent treatment, special care. All your issues regarding your kidneys will be addressed. So, to answer your question, we are actually reaching out to nephrologists. We have gone to many hospitals, doctor directors of hospitals, to tell them what is going on, and we are receiving a lot of calls from them. Hospitals are calling that they would need us. We've had calls from at least how many hospitals? About 2 or 3 hospitals.
And also use of social media.
Yeah.
Okay.
Actually, that same day we were doing the launching, I believe somebody posted it on Facebook, and we received a call from America. Somebody saying, oh, my mom is on dialysis. When are you starting? I want her to come here. And also the reps from Fresenius, they saw the machine and they were like, oh, Fresenius always wants any patient coming from all over the country to Nigeria. They need a clinic that uses their products, that is, they are familiar with. So with that, we are already knowing that at least they have a sister company here, which they can always refer their patient. But we're actively going to use the social media, also word of mouth, flyers, everything that we can use for marketing.
All right. I know I already asked about, other branches and all that, but in the shortest period of time, what do you see this becoming? How much do you see it growing?
Yeah, what do I see this becoming? I'm glad you asked me that question because of where I was before, we came to this point of going forward with the business. This to us is a mission. This to us is about legacy. This to us is about, giving back. So I see this becoming as a place where people come and get treatment. People come and get lifted up in the spirit. People come and get blessed and healed and saved. And I see it as a place where patients long to come to because there they will come and get refreshed and go back home. Kidney disease is very depressing, and living with it is really challenging, very challenging. So apart from just hooking them to machines and giving 3-4 hours of treatment, we also have to address those components. You know, the component of their well-being, of their emotions, of the
Their
challenges they
diets.
face, their diet. We have a dietitian on board. All those things we have to put together, such that when you step in there, you have a complete care.
Like a wholesome thing. It's
That
not
is
just
right,
the dialysis.
exactly.
It's not just the dialysis.
So the whole being is addressed. The whole being, because you can get excellent treatment, but you stay depressed.
Sure.
You know, so we want to address all those things as the Lord would want us to do it.
Thank you so very much.
Thank
I
you.
have been speaking with Dr. Sylvanus Achu, who is a medical doctor, and Mrs. Oluwafumike Achu, who is a nurse and entrepreneur. Thank you very much,
Thank you.
lady and gentleman.
Thank you.
It's back to the studio now for more. Stay with us.